Tourism is an option that a lot of people go for because of the savings. It tends to be cheaper to go to another country, in particular a developing country, because the US dollar simply stretches further. And a lot of the marketing is very heavy on, you're gonna get this luxury situation, be recovering on the beach, private nursing, beautiful hotel suites, waterfront, and it's practically like you're not having surgery at all. And from what I understand and what I've been informed of by people who have actually lived through and done these situations, is that what I just described is the minority. Most people are not having a situation or an experience that lines up with what they were sold or what they believed they were buying. Unfortunately, also in the case of this person who was traveling to Mexico, there are safety and security issues. If you are having a surgery in a surgical procedure in a United States hospital, you're probably not going to get kidnapped on your way to the surgery center. Even if that surgery is happening in a sketchy neighborhood, let's be real. And that's something that I think as Americans we take for granted, is just having this inherent overall security wherever we go. Yes, crimes happen, carjackings, robberies, etc. But for the most part, walking around, most of us are not afraid of being dragged into a van and hauled off by kidnappers at gunpoint and sadly losing our lives. And that's just something obviously you're gonna take even further removed from medical procedures. The second thing is that overall, when you're having surgery in another country, none of the rules and regulations that you enjoy as an American citizen having surgery in the United States apply to you. So for example, in the United States, we have governing bodies that kind of guide what we do as board certified plastic surgeons, right? So for example, in plastic surgery, the American Society of Plastic Surgeons releases guidelines periodically based on research and data collection, looking at the entire country, procedures that are done, complications that patients have as a result of those procedures. They actually look at that, they're monitoring that, and they're changing their guidelines based on it and telling us as a group what their best, the evidence suggests is the best approach to certain procedures. So, applying that to another country is simply not valid, and not to say in any way to disparage individual surgeons and physicians operating in other countries. Other countries produce great surgeons just like the United States, and responsible doctors too. But the overarching legal system that protects you here in the United States, if something goes wrong, if your surgeon doesn't show up for surgery, if you die on the operating table, if your surgery center closes, if anything is to happen to you, you don't have much in the way of legal recourse. Whereas in the United States, if you have an issue with your surgeon, you always have an overarching legal system, a regulatory system that drives the bus and gives you some kind of recourse if you are unfortunately wrong. The third thing that I think is really important people don't think about, at least not long term, is follow-up. Yes, they're gonna keep you there for maybe a couple of weeks post-op, give you some massages and all that, but invariably, most of the time, they're gonna remove your drains before you go. And while that may work for a lot of people, there are also a lot of people that I know this happens to, because we get these calls to my office, who end up with what's called a seroma, a fluid collection. And this is a very, I guess this is a more simple possible complication that you'll deal with, but it's very common. And the reason that is because the drains are removed too early. If your trip is over in 2 weeks, but your drain isn't ready to come out, they're gonna pull it anyway and send you on your way. And the reason they can do that and not really do is because they don't have to deal with the consequences. They don't have to deal with draining your seroma, deal with making sure it goes down, deal with finding you a surgeon here in the United States who's even willing to take you on as a patient and deal with the complication that you're walking right through the door with. And that's a simple one. If you have major complications, it gets even more difficult. Now you also might have to worry about your insurance covering any major complication issues that may arise. You're gonna have to find a plastic surgeon who is able and willing to take you on as a patient and deal with your case. And in the event of your life being threatened by something like an infection or whatever, hopefully you're gonna go to a hospital that even has surgeons on staff that are going to be able to help you and give you the medical care that you need to get better and then to look better and get the result that you were looking for. And lastly, the finances of what I just mentioned are horrific. If you've ever come across a story of someone who went to another country and had a procedure and it did not work out the way they planned, and now they need to get corrective surgery, the finances of that are extremely, extremely challenging. And most of those patients sadly end up either starting a GoFundMe page or leveraging some other asset they have to pay probably triple what they would have paid if they had the procedure done in the United States in the first place. So again, this isn't to disparage any other countries, but it's just to put information out there so people really know what is it that you're potentially signing up for when you're going to have surgery abroad, and what are the things that you're giving up while you're saving money. What are the things that you are inherently giving up when you cross that border as a patient that you would enjoy as an American citizen having surgery in the United States.